I'm Dr. Beth Hodges. I'm a local physician as well as a medical director for HealthTeam Advantage. HealthTeam Advantage is a local PPO and HMO Medicare Advantage plan headquartered right here in Greensboro, North Carolina. And I'm here today to talk to you about fall prevention. I'd like to tell you a story about Mrs. Smith. Mrs. Smith is a 72-year-old retired school teacher. She lives alone. Her husband is deceased. Her children reside out of state. But she leads the life she wants to live. She does country line dancing a few nights per month. She gardens in her yard. She's very content and happy. One day, Mrs. Smith slips in the shower and breaks her hip. After surgery and a brief stay at a rehabilitation facility, she returns home. She can no longer use her bedroom, which is on the second floor up a steep staircase, and she has to use a rolling walker to get around on uneven surfaces. She can no longer get her own groceries because she can't easily and safely drive a car. Mrs. Smith has to give up her independence and move into assisted living. Does Mrs. Smith's story sound familiar to you? Perhaps it's happened to a friend, a former coworker, or to yourself. We want to help keep you safe in your own home and keep you from living out Mrs. Smith's story. Fall Prevention Week is September 21st through 25th. This is a cause I seriously promote for members of HealthTeam Advantage. Medicare recommends that every Medicare recipient undergo an annual fall risk screening assessment. It consists of some simple questions that we're going to review right now. First question is, have you fallen in the past year? The second question is, have you been advised to use a cane or a walker to get around safely? Question 3, do you sometimes feel unsteady when you're walking? Do you steady yourself by holding on to furniture when walking at home? Are you worried about falling? If you're worried about it, you're more likely to fall, studies show. Do you need to push with your hands when you go to get up from a chair? Do you have trouble stepping upward onto a curb? Do you often have to rush to the toilet? If you have to rush, especially at night, that could cause you to fall. You want to make sure that your path to the bathroom is clear and there are no rugs to trip on. Have you lost some feeling in your feet? This could cause you to stumble and fall. Do you take medication that sometimes makes you feel lightheaded or more tired than usual? Do you take medication to help you sleep or improve your mood? The last two questions raise the issue that medication side effects can make you more prone to falling. Do you often feel sad or depressed? Not feeling well or being slowed down by depression increases your chance of falling. If you answered yes to 4 or more of these questions, you are at risk for falling and should talk to your doctor.